Many people have heard of something called all-on-4 dental implants. The idea is simple, a full set of teeth supported by just a few implants. But the traditional process can sometimes take months with multiple visits, and you know how frustrating it can be. Eating becomes difficult, smiling becomes uncomfortable. But inside this facility, a different approach is taking shape. It's called the Forever Smile. At the center of it is Dr. Vibert, a doctor with a passion for improving the way full-mouth dental implants are done. Dr. Vibert gave me a tour of his facility, including the dental lab, where he showed me all of the latest cutting-edge technology involved in this highly refined process.
Dr. Vibert, for people at home who may have never heard of Forever Smile, what exactly is the Forever Smile procedure?
The Forever Smile procedure originated from what was called the all-on-4. It's a procedure that's been around since the late 90s, I want to say 96 or 98. This procedure originally came about to try to solve the problem of helping people get rid of dentures and helping people get implants immediately. The Forever Smile was essentially born from the all-on-4 procedure. And what I realized quickly was that the all-on-4 process worked, and it worked very well. The issue that we had with the all-on-4 was the restorative portion, meaning not putting the 4 implants in. That's relatively the same from the all-on-4 to the Forever Smile. It was making the actual teeth that is what we kind of revolutionized. So the original all-on-4 process, it took about 20 appointments to get from the beginning to the end. And now with the Forever Smile, we're able to get from the beginning to the end in about 6 or 7 appointments.
The Forever Smile is available at multiple locations. Each office offers the same advanced technology and experienced clinical team.
So, Dr. Heron, one of the things, right, that people are very surprised about is the timeline of the procedure. I mean, is it true that you can actually come in with serious dental issues and walk out with a brand new smile same day?
Great question. So that's actually one of the things that makes me really happy and excited to go to work. I would not be saying the same thing maybe 8 years ago when we used to put dentures in, and it was one of the most traumatizing things for patients to come in and then walk out with something that is so foreign and it doesn't fit and it hurts and overall doesn't function. But now with these implants, they're excellent. They feel just like your teeth.
Instead of old-fashioned molds, the process starts with a high-resolution digital scan of your mouth. That scan allows doctors to design your teeth with incredible precision.
So, doctor, this is really important, right? This tool here is very important. Can you explain to us a little bit about what exactly is happening? What do you do with it and why?
Absolutely. If you remember back in the day when we had a mold to be taken in a dental office and camera for 5 minutes, well, those 5 minutes feel like
And
forever.
the taste is
the
awful.
feel of it. This actually replaced that whole procedure. Now we can just have a small camera that goes inside of your mouth and it can scan the teeth in real time that is very accurate.
So what it's doing, it's basically taking thousands and thousands of tiny pictures of every area of your teeth and then using that to come up with a 3D model.
This remodel, exactly. That is in a digital format that can now be transferred electronically to labs, to doctors, to me, to the patient, whichever.
Gotcha.
Patients can visit their offices in Manorville, Hauppauge, and Garden City on Long Island, and their newest location in Totowa, New Jersey.
So, Dr. Khan, there's obviously a lot of options out there. People, I mean, you see ads all the time. What is it that is unique about your procedure or even your office that really sets you apart from everybody else?
If I had to say it in one word, I would say compassion. Again, if a patient comes and sees any one of us for our consultation, you'll see how compassionate we are towards what they're going through. And that starts with that explaining part, as I was mentioning. That's really what's different. It's the doctors that drive this treatment, and we are there with you from first step, which is the consultation, till your very final step, which is your final set of teeth, and we take you from point A to point B together. So that's what's really different when it comes to this procedure.
So, Doc, there's obviously a lot that goes into coming up with that perfect smile, right? And I know that this part of it is definitely extremely important. So can you explain exactly what is happening here and why it's so important?
Absolutely. So as you saw the first part, which is the scanning part, the intraoral scanning. So while we are in surgery, the lab is here designing those teeth. They use the scan and they will go ahead and virtually extract all those teeth, and you will get to something like this.
And now this is unique to every patient, correct?
Correct.
Is there any customization? Is there any input from the patient to determine exactly what that final look is going to be?
Absolutely. If there's patients who are really worried about their smile, when we start moving towards their finals, and we can nitpick these things, and I can manipulate these teeth however I like. And that's the beauty of the softwares and being able to do that. So from here, we just place this, whether this is a same-day surgery, we can print them, or if you're going to finals, we can mill them.
For a visitor walking through the lab, the process is striking. Rows of advanced printers, digital design stations, technicians carefully finishing each set of teeth by hand. It's part science, part art. And it's exactly the kind of environment that Dr. Vibert envisioned when he began perfecting this procedure.
So Dr. Vibert, I understand this is where all the magic happens. So what are we looking at here?
In this room, basically, this is our 3D printing room. We have multiple 3D printers, different generations, different brands, different applications. These were the original ones. This is the machine that allowed us to print the first set of teeth probably in the world.
Wow.
And deliver them the same day. So the way 3D printing works essentially is the patient's teeth will get designed in a CAD software. That file gets sent here, and then essentially the printer will, from a liquid, make their first set of temporary teeth.
Walking through the lab, you quickly see the combination of science and craftsmanship behind every smile, using powerful 3D printing and Zirconia milling technology.
So Doctor, we left the 3D printing room and now we're in the mill. So can you explain to us a little bit about what is happening in here?
The 3D printing room is basically where we make our temporaries and what we call our try-ins. Then what happens is that file, the CAD file, instead of being sent to the printer, it's now sent to the mill. And what happens is basically that will now mill out their Zirconia final bridge. Zirconia is a very strong porcelain. It's milled in the milling machine, so this pup will actually be placed in there and then it will mill out the teeth. What happens is then this will be in an accuracy of about 10 microns.
Wow.
So there's a lot of hours spent on this.
Absolutely.
And then once that is basically approved, then this will get sent to the oven.
So Dr. Stewart, who would you say is the typical candidate for the Forever Smile?
There's patients that either have a lot of cavities, there's patients that have a lot of bone disease, there's patients that have worn their teeth down so much to a point to where they can't cement anything on them because the teeth are just basically destroyed, whether it's from trauma or just having a really strong bite. Or there's a lot of patients that are in complex dental situations. And what I mean by that is that their laundry list of needs is so long in terms of getting cavities, maybe a partial denture, a bridge, they might need a root canal, and you see that there's almost 20 to 30 things needed. And by the time that you're considering getting through all of that, you're looking at the age, you're looking at the medications they're on, they have dry mouth, the teeth are kind of starting to decay. You really want to kind of get ahead of that issue and then consider doing something that's more full mouth. And so that becomes more of a philosophical discussion at that point in terms of, am I ready to do this now, or do I want to try to get a little bit more mileage out of these teeth? And we kind of are here to help hold the patient's hands to figure out that.
So Dr. Stewart, what are we looking at here, right? We're now in the final stages here of this whole process. Can we talk a little bit about that?
Yes, absolutely. So as you can see, I set out some models for you so you can understand this process. The final stages of making the teeth, this is where the true artistry comes in. We actually have lab technicians that work back here, and what they do, you can see right here with the paintbrushes, they actually go through, they do custom shade matches on everybody so that the prosthetic perfectly matches their gums. You can kind of see it has like fun Crayola names.
I see.
We have plum, sorbet, linen, snow, flamingos. We do a mixture of all these different colors. It gets hand painted on, and then it goes through this firing process right here. After that, we have our final checks and balances and just making sure that everything's nice and smooth before we deliver the prosthetic to the patient.
The mission is simple: 4 implants, 4 hours, forever. Because sometimes the most important transformation can happen in just a few hours.